Hello, I'm Jawad and I'm the Exec Medical Director at East Lancs NHS Trust. It's my update on the 23rd of November 2021. Now, unlike the last time where I've usually gone through the numbers of people who are positive in the community with COVID-19, I'm going to focus on a few pertinent issues, but still would say that our community transmission rates are still high. And that's what we have to be very mindful of. I'm also conscious that 4 weeks down the line we'll be in very much celebratory and festive mood, and rightly so. People deserve that joy and fun and time together with the families. But please do take certain context into this when you are thinking of celebrating. During the celebratory days and weeks, please be sensible, especially with alcohol, especially on the roads when you're driving. The number of transmission of COVID-19 is still ongoing in the community, and you probably have heard on the national and the international news of what's happening on the continent. Certain countries have started putting national lockdowns. Now, this is not the place we want to be and hopefully won't come to. However, there's always that risk. So what can we do to help our communities, help ourselves and each other? The first thing is what we have been talking all along the pandemic, which are the precautionary measures that you can take to prevent the transmission of the virus. And remember, it's just not the COVID-19 virus, it's the flu virus. We all know that flu is a big killer, especially of our vulnerable population. So we have to take steps to prevent the transmission of all sorts of respiratory virus, flu virus, COVID-19 virus. And you can start with by wearing masks, especially when you are in crowded places, in public places. Do take special care about hand hygiene. We have been mentioning about hand, face, air, space. So let's bring that back into practice, because these are the measures that will help prevent transmission of the virus. So hand hygiene is very important. Social distancing remains an important measure, and wearing masks also is an important measure. Now, as we say, the world has opened up. People are attending various gatherings, parties, celebration. One thing which we can do is to help with the testing. If you are going to a big gathering, there is no harm to do a lateral flow test. It is available, free of cost. Do that. Ensure that you are not an asymptomatic carrier who unfortunately can spread the virus. So testing is important. But at the back of all this is the need to be vaccinated. Now, there is enough data out there which tells us that not only the first and the second dose of the virus, the COVID-19 vaccine has helped, but also the booster. We know that after 6 months of the second booster, the immunity starts to wane. So if you are being asked to come and have that booster, please do so. It is very important for yourselves, your families, and the communities. Now, the other thing which I have always been mentioning in the last few weeks is the pressures on our systems. We as NHS are there to help the people with their management of the conditions, but also the right conditions in the right place. We have talked about the availability of 111. It is online and on telephony. So if you want to, you can access either of those, and that will help you to get to the right place. Our GPs are working incredibly hard. They are available to help you. Pharmacies are doing the same. As the word accident and emergency department says, it is accident and true emergencies. Our teams are there to help people who are brought into those departments. If you don't think you are in an emergency and urgent condition, then there are other areas, as I've mentioned, about 111, GP surgeries and pharmacies who can help you manage the condition. So please think before you start making a journey towards the local accident and emergency department. And finally, most importantly, look after the elderly, the vulnerable in your neighborhood, in your community. Support them. COVID-19 has not only brought physical ailments but also mental pressure and stresses. Speak with each other, help out each other, and support each other. That is the only way we will be able to come out fighting through this pandemic which is still there. Look after yourself and take care, and I'll update you in a couple of weeks' time. Bye for now.